Hey, I'm Dr. Cole with Mid-Atlantic Chiropractic. Today we're going to be adjusting Gloria.
Am I getting adjusted?
Yes.
Yay! I thought I was filming it.
Good job. And I'm going to be showing on the spine model what I'm doing. This is a lumbar model. It does differ greatly from the thoracic and the cervical bones, but just for today's premises, we do have all the major landmarks as well as our disc here. So it should make a little bit more sense compared to if I didn't have a model. So now that we have Gloria's listings pulled up, I know that we need to start off by doing some counter nutation. I typically work my way bottom up. Take a look at the feet here. Gloria's usually pretty good, which means that we typically don't have a pelvic listing, which means that we do still have a sacral listing, counter nutation. And so what counter nutation is we're bringing the sacrum down and back. There's actually a small cavitation there just by doing that movement. On the model, imagine that her tailbone is a triangle piece here. What I'm doing is I'm rocking that tailbone back to open up and create more space between the L5, S1 discs there. We like to use the diaphragm to help traction this disc. So I'm gonna have her take a big deep breath for me. Hold. Exhale. And again, big deep breath. And one last time, big deep breath. Exhale. So a lot of the videos I do, you'll see me stretching the patient by grabbing the lower extremity here of the calf, and then you'll feel my hand moving up along each one of the articular processes of the thoracic spine and the ribs here. So let this shoulder drop, let this one drop. That arm, good. So the reason I did that was to get the scapula out of the way, let the other one drop. And so she's pretty tight today. When I'm doing that motion, imagine if this were a thoracic vertebrae, we'd have articular joints here, and each one of the ribs curves around in a C shape. So when I'm feeling and I'm distracting up, I'm trying to create space between not only the disc and the vertebrae, but also distracting those rib heads as well. So I'll do the adjustment first and then show on the model. Her spinous processes are rotated towards the right. So we're going to contact on the mammillary process here. Good. Now if you take a big deep breath all the way out. And again, all the way out. And one more time, all the way out. The way that I'm contacting there is we are rotating a spinous process that looks like that for the most part, and we're pushing down this way, helping to rotate it from right to left. That would be a spinous right listing or a body left. I'm going to have you go onto your back for me. Next, we'll be doing the thoracic spine, and we're going to be doing adjustment to help create more of a kyphosis here. So it's called a flexion anterior thoracic. You'll see my hand here. We're going to contact with the palmar aspect of my hand. She's going to take a big deep breath all the way out. Good. And again, all the way out. One more time. All the way out. Good job. And she can relax back down. What I'm doing there is, obviously, if I was directly on the bone, that'd be uncomfortable. So I take my hand like this, and we're actually going to have the spinous processes in between my fingers and my thumb here. Gloria was pretty locked up, especially in the upper thoracics, which means that we're probably going to do lower cervicals today. Feeling Gloria's neck here. So down on the right, we're feeling C7, T1. Is that pretty tender there? Mm-hmm. So we're going to do extension, which means coming straight across. And we've got one more here, laterally bending, and then do an extension. All right, and I always finish off with a little bit of distraction here. Awesome. So that's a pretty routine chiropractic adjustment for Gloria. Next, we'll show you how we do decompression. So we start out with the table flat here, but I'm gonna have Gloria take a seat, and then she's gonna lie on her back so she can go ahead and do that there. With Candy decompression, I'm gonna be feeling for the top of her hip bones here, and we wanna make sure that we're getting that belt as up on those as possible and not too far above. It's gonna be nice and tight like a corset with another strap over top to help secure everything in place. Now our anchor is gonna be this strap here. It's gonna come across the midline, and we'll cinch that tight so she's not going anywhere. Is that comfortable there? Yeah. All right. Next, we're going to elevate the leg piece here. That's going to put the sacrum into that counter nutation motion. Is it okay if I reach between your legs to apply this? All right. So we're coming up, pulling the strap there, pulling these two tight, and then we're going to anchor it to our decompression machine there. Next, we're going to place a roll underneath her feet, and she's a little short, so we're going to have to roll this up a little bit. And then I've got 2 wedges, which are going to help stabilize and anchor her upper body. So we're going to roll this way. Good. Drop back down. And now this one. Good. And the patient can move those to tolerance if you need to, Gloria. And next we need to unlock the table, and we're going to raise her on up. Going on up, nice and slow like an elevator. Once the patient has reached the top here, I do have a level on the right-hand side, and that's to make sure that we are nice and straight, because what we're doing is y-axis distraction, meaning that we have 2 vertebrae sitting on top of each other with a disc that's compressed underneath. And so what this machine is doing is we're slowly and gradually over time decompressing that disc, allowing it to rehydrate to create more space. Most patients find this to be very comfortable. The way that we set it up is based off of a percentile of their weight, typically 30%. Each one of our patients does have a file with their specific weight on it, just so patients know. Each one is tracked individually. Because I do this to Gloria so much, I do know her parameters. We're going to be doing the L1 setting, which is a 12-minute session. The machine is going to start out by doing a gentle pull. The table is unlocked now, and it's not going to look like the table is really pulling too much, and that's because there's really not too much of space between those 2 discs. So the patient should feel gentle, relaxed. How does that feel, Miss Gloria? Good. So next thing we'll do is we'll turn on the vibration here, let her relax, and then we'll cut off the light. So Gloria's session just ended, so we'll see the tension being pulled out by the machine until the actual tension gets down to 0. And now we see that this cord no longer has tension on it. It'll be easier to pull off. And then is it okay if I reach through to unconnect this? Perfect. All right. So we're going to make sure the table is locked here, which it is. And then we're going to lower down. Good. Remove the cushion and lower her back down to neutral. All right, so I'm going to reach across here, disconnect everything that we have pulled up. Good, good, good. I'm going to remove the blocks from here and have the patient relax, and then when they're comfortable, they can go ahead and hop off the table. All right, so that was Kennedy decompression. If you guys have any questions about it, please feel free to ask me in the comments. Thank you.